Welcome to another explanation by Basma. Today's topic is bone cancer. What is bone cancer? Bone cancer is a malignant tumor of the bone that destroys normal bone tissue. Not all bone tumors are malignant. In fact, benign, non-cancerous bone tumors are more common than malignant ones. Both malignant and benign bone tumors may grow and compress healthy bone tissue, but benign tumors do not spread, do not destroy bone tissue, and are rarely a threat to life. Bone cancer most commonly affects the pelvis or the long bones in the arms and legs. Bone cancer is rare, making up less than 1% of all cancers. It either originates from the same bone as in primary cancer, which is less common, or spreads from another organ, which is secondary cancer. Those two types are often treated differently and have different prognosis. Bone cancers are more common in children and younger adults than in older people. Cancer found in the bones of an older adult usually has spread to the bone after originating from another location in the body. Risk factors. It's not clear what causes bone cancer, but doctors have found that certain factors are associated with an increased risk, including previous treatment with radiation therapy, previous chemotherapy with specific drugs, mutation in specific genes, implantation of metal to repair previous fractures and breaks. Symptoms. Pain is the most common symptom of bone cancer. The bone pain may initially develop at certain times of the day, often at night or with physical activity. The pain tends to progress and worsen over time. Sometimes the pain may be present for years before the affected person realizes he or she needs treatment. Occasionally, a mass, swelling, or lump is felt around the area of bone cancer. Bone fracture can also occur at the site of bone cancer because the underlying bone structure has been weakened. Fatigue and unintentional weight loss are also included. Less common symptoms are caused by compression or disruption of nerves and blood vessels in the affected area. These symptoms can include numbness, tingling, tenderness, or decrease in blood flow beyond the site of tumor, causing cold feet or hands with weak or absent pulses. Diagnosis. To help diagnose bone cancer, the doctor asks about the patient's personal and family medical history. The doctor also performs a physical examination and may order laboratory and other diagnostic tests. These tests may include the following: X-ray, bone scan, CT scan, MRI, biopsy, or blood test. When to see a doctor. You should go to the hospital if you develop pain that comes and goes, becomes worse at night, isn't helped by over-the-counter pain relievers like Profen. Treatment. Surgery is the usual treatment for bone cancer. Dramatic improvements in surgical techniques and preoperative tumor treatments have made it possible for most patients with bone cancer in an arm or leg to avoid removal of an entire limb. Chemotherapy. Patients who have bone cancer usually receive a combination of anti-cancer drugs. However, chemotherapy is not currently used to treat chondrosarcoma. Radiation therapy. Radiation therapy involves the use of high-energy X-rays to kill cancer cells. This treatment may be used in combination with surgery. It is often used to treat chondrosarcoma, which cannot be treated with chemotherapy. It may also be used for patients who refuse surgery. Cryosurgery is the use of liquid nitrogen to freeze and kill cancer cells. This technique can sometimes be used instead of conventional surgery to destroy the tumor. Thank you for listening. This was a short explanation of bone cancer.